In this video, we're going to be going over the functions of veins, and we're also going to look at aneurysms. Veins are vessels that carry blood toward the heart. Basic definition. Now, it isn't that they carry deoxygenated blood, because we're going to see that there are some veins that carry oxygenated blood. Basic definition, though, is that vessels that carry blood toward the heart are called veins. The smallest veins are the venules, and they form when capillaries unite to converge to form larger veins. Here is a capillary bed. Remember, the arterial brings blood to the capillary bed, goes to the capillary bed, and then this blood is going to go into a venule, which is then going to go into a larger vein. The walls of veins are relatively thin, and lumens are relatively large. So looking at this histological photo, you see this is the wall of a typical vein. See how thin that is compared to an artery, which the tunica media on this artery is a lot thicker because it has a lot more smooth muscle. Veins have one-way valves to prevent the backflow of blood. Remember, the venous system is under lower pressure, and so that blood, as it moves towards the heart, can pool in the vessel. To prevent that from happening, veins have one-way valves so that it keeps blood going in one direction towards the heart. And these valves prevent the blood from going backwards. And the veins in the venous system are extremely distensible. In fact, typically they contain about 65% of the body's blood volume. Now, as I said earlier, veins are typically deoxygenated, but there are some exceptions. For example, the pulmonary vein is oxygenated. Remember, in the heart, you have the right-hand side of the heart that receives deoxygenated blood. And when this right ventricle pumps the blood to the lungs, it goes out via the pulmonary trunk and into the left and right pulmonary arteries. Well, this is deoxygenated blood, but because it's carrying blood away from the heart, it's called an artery. But this artery has deoxygenated blood. Once it gets to the lungs and picks up oxygen and gives off CO2, this blood is going to come back to the left-hand side of the heart, and it's getting there via the pulmonary vein. Remember, veins carry blood towards the heart. Since this is carrying blood towards the heart, we call it a vein, but it's carrying oxygenated blood. Hence, not all veins carry deoxygenated blood. Another example is the umbilical vein. Shown here is the placenta, and this is the umbilical vein carrying blood into the heart. Well, this umbilical vein, since it's going towards the heart, it's called a vein, but it's carrying oxygenated blood from the placenta. So those are two examples of veins that carry oxygenated blood, but most of them are going to carry deoxygenated blood. The valves that are located in the veins help the blood to flow in one direction, so it doesn't pool. Arteries don't have these because they're under higher pressure, and this higher pressure drives that blood towards the arterioles and the capillary bed. Then once it comes from the capillary bed into a venule and then to the larger veins, it's a lot less pressure. In fact, if you look at the blood pressure that happens in the venules and veins, remember, the blood pressure, measured in millimeters of mercury, is a lot lower after it goes to the capillary bed into the venules and veins, and then finally the vena cava, which is going to deliver blood back to the heart. You have the superior and inferior vena cava. Since it's under lower pressure, the veins have one-way valves to keep blood going in one direction and not pooling in those vessels. So as blood moves towards the heart, it'll open up the valve, and then it tries to come back, then it's going to close the valve. And your skeletal muscles can help in moving this blood. Here's, for example, a skeletal muscle in the calf. As it contracts, it pushes blood in both directions. The blood that's pushed this way, going towards the heart, opens up the valve and continues towards the heart. But the blood that's pushed back is going to close this valve to prevent that blood from going backwards. So it keeps it going forward. These are muscular pumps that help to pump blood in the venous system to get it back to the heart. That's why moving around and not standing in one position for too long, contracting those muscles in your legs, can help return blood flow to your heart. Here's a typical vein. Here's a typical artery. You can see the difference in the wall size of a vein compared to an artery. Arteries have a lot more of that smooth muscle in the tunica media. Veins have one-way valves. This is showing a one-way valve here in a vein. Here's another one-way valve. These are one-way valves here. You can see a little cusp that are going to stop that blood from going in the reverse direction. You can find these valves in your own veins just under the surface of your skin. For example, what you do is you take your finger and you put it on the vessel and then you move it away from the heart. And as you move it away from the heart, it'll collapse because this valve is stopping the blood from going backwards. That way it moves towards your heart. Let me show you a video on how you can find your own valves on your veins. You can find the valves to your veins on your own body. So for example, you take your hand and you pump it up and you get the blood flowing through there. And then you find a good old vein, which you can see right here. And I'm going to take my finger and I'm going to go away from the heart. So when you push the blood, you're going away from the heart. And I take my finger and I do this. And you can see that the vessel or the vein has collapsed right below where that arrow is. In fact, I put that arrow on there so you can see where it is, where the valve is. And when I let go of it, the blood goes right back in. So I take my finger, I go away from the heart, the valve closes, boop, and it goes right back when I let go of it. Take my arm, I turn it over, and here's another one. You can find the valves, and watch this. Take my finger, go away from the heart, let go, oh, there it is. You can find all of these valves all over your body. Put little arrows on them to show your friends. It's really cool. The body's just fascinating. What happens if the valves aren't working correctly and they don't close all the way? Then you can have a condition known as varicose veins. That's where the valves just don't close all the way. So blood, instead of being stopped by this valve, is going to move backwards, and it can pool and cause the veins to expand, giving you varicose veins. Here are examples of pretty bad varicose veins. Varicose veins are abnormally dilated and twisted veins. They result from leaky valves. These veins become so dilated that these cusps of the valves no longer overlap to prevent the backflow of blood, and then that blood is going to pool. What can they be caused from? Well, genetic factors. You can have valvular incompetence, or as you age, those valves can give way. They're not as strong. A decline in muscle tone can also cause this. Remember, that muscle helps to move that blood through the venous system as it pushes on those veins. If you stand in one place for long periods of time, which allows the pressure of the blood to stretch the veins. So remember, you want to contract that calf muscle, contract those leg muscles to help that blood return to the heart. Pregnancy. During pregnancy, you have compression of the veins in the pelvis by the enlarged uterus, and this can result in increased venous pressure in the veins that drain the lower extremities. Hemorrhoids are nothing but a varicose vein in the anal-rectal junction. And these can pooch out, and they can be very painful. There's just these valves that are in there that aren't working the way that they should. There are various treatments for varicose veins. You have a sclerosing solution that when they inject that in there, it causes the vein to shrivel up. You can also surgically strip the varicose veins, although that's not done as often. More frequently, they do what's called endovenous laser treatment, and this is where they can use pulses of laser light or radio frequency. And as they pull this catheter through the vein, that laser light or radio frequency can cause this to shrivel up. Now, this vein won't be able to be used anymore. What will happen is the body will build other smaller veins around there in order to return the blood flow to the heart. So your body will make more veins, but they'll be smaller. And these type of treatments can greatly help varicose veins. Let's test your knowledge. Go ahead and pause the video and select the term that makes the sentence correct. Here are the answers. Aneurysms are a ballooning out of an artery, and these can be life-threatening if the artery bursts, which is a ruptured aneurysm. This occurs because of a weakness in the arterial wall, which may result from age-related displacement of elastic fibers by collagen. So here's an example of the aorta, descending aorta with a large abdominal aneurysm. It can be associated with atherosclerosis, and if the aneurysm becomes too big, they can go in and put a sleeve around here to prevent that aneurysm from bursting. Let's test our knowledge. Go ahead and pause the video and select the term that makes the sentence correct. Here are the answers. This concludes the video, and let me know if you have any questions on this material.